Hi, ladies and gentlemen. It's Dr. Julian Novoa. I have a lot to talk about today, and I'm going to try to crunch it into 10 minutes or less. First of all, I wanted to thank and extend my incredible acknowledgement of support for the Essure Problems Forum. Yet again, I know that all of their work continues to pay off, specifically associated with the United Kingdom having announced that due to a financial decision, they have will stop selling Essure in the United Kingdom, which includes England, Wales, Scotland, Northern Ireland, and we already knew that Finland, the Netherlands, and Brazil were no longer going to be no longer had the product or will no longer have the product being sold in their country. Brazil banned it for other purposes, not for Brazil specifically banned it, and not a decision made by Bayer. And Brazil did it based on actual research rather than on a financial decision, which Bayer made their decision to ban it in Finland, the Netherlands, and the United Kingdom based on their idea of financial benefit rather than a medical benefit for the patient. Although they still state that the benefits outweigh the risks, which I happen to strongly disagree with, and I'm sure the vast majority of women that have the device in place and are having problems would strongly disagree with. What I wanted to address also was the continued lack of support from the FDA. The FDA on February 29, 2016, had ordered Bayer to conduct post-market trials to basically confirm that the device is actually safe, not just effective for permanent sterilization, but actually a safe product, and also to take a look at potential side effects that were not covered in the original trials. And from the last that we've heard, because FDA has not responded to our request for information, they should have at least started the trials on May the 29th of this year, which that was just last week, and I don't even think they've started the trials, let alone have any information on when they're going to start the trials. So let's address that in a specific point. First of all, although the original trial studies supported the idea that the fallopian tubes could be closed by the Essure with greater than an 80 or 90% efficacy or efficiency, it didn't address the side effects that we've been seeing over the past since it was placed on the market. And specifically, those side effects, which occur in up to 30% of patients, we're looking at problems with menstruation, dysfunctional uterine bleeding, irregular bleeding, painful periods, lower back pain, pain with intercourse, and that's just with GYN-related issues. Now we have to look at the autoimmune problems such as brain fog, memory loss, cognitive changes, depression, chronic fatigue syndrome, the elevated weight gains, the e-belly, and this, as far as the rashes, and this commonly associated with something called systemic nickel allergy syndrome. Even if you're not allergic to nickel, you can become allergic to nickel, and this becomes an issue with that problem when you have the Essure device in place. Also to include irritable bowel syndrome, symptoms of problems related to being able to eat certain foods, all fall into an autoimmune reaction that can be associated with systemic nickel allergy syndrome. So we run through this gambit of symptoms and problems and syndromes associated with the Essure, and we still have not been able to get this device removed from the market. Other countries such as Brazil did the right thing, and Bayer has decided, based on an economical issue, that they're not going to that they have pulled it out of other countries, but they're not going to pull it from the United States. And why is that? Well, first of all, we have to look at the protection that the device has here in the United States, which is protected as Class 3 preemption status. So that basically means that even if the device is causing problems, the corporation of Bayer is protected from litigation lawsuits under Class 3 protection that the FDA granted it. So for right now, even if you did see that there is a direct correlation in clinical studies. That's what they were supposed to be looking at. But we know, as the clinicians that are seeing patients, that there is a correlation, that there is a very high correlation between one and the other. That for right now, Bayer does not have any reason to pull the device off the market because it's protected. Now, if it decides to do so for altruistic reasons, that would be great. But we're looking at a large corporation that devoted billions of dollars worth of to purchase the device, as well as has spent over $500 million in litigation trying to defend the device above the Class 3 or challenging the Class 3 preemption status. And so far, it's not cost effective to pull the device off the market. Put aside the fact that it may be harming patients, or that it may be it has a potential risk of killing patients, or high potential risk of causing losses of pregnancy, and obviously failures as high as 9%, which is 15 times higher than traditional tubal ligation. Put all those things aside. For right now, Bayer has decided that it's still profitable to keep the device on marketed here in the United States as compared to other countries where it's not. So this is where we get to what I wanted to talk about today. When is it not going to be profitable for the device to be marketed or used in the United States? For right now, the main reason that it's still profitable is because doctors are still placing these devices. So basically, you can say what you want to say about Bayer, say what you want to say about the FDA. The bottom line, the gatekeeper to this entire thing is the doctor. And I've been saying this for the past 4 years. When things are going to change is when there's going to be litigation. And the litigation has started in a vast majority of cases against Bayer. But when litigation start against doctors, that's when you're going to see this device no longer placed, because we're still ignorant to the fact that many of us are still ignorant to the fact that the Essure device even causes problems, let alone what those problems are. So when you're talking about your the general GYN doctor, put aside the doctors that actually put the device in. The general GYN doctor, the ER doctor, your primary care physician, your rheumatologist, most of the doctors, most of my colleagues either have never heard of the Essure or don't know anything about the Essure or how to manage the complications of Essure. And so you have a vast ignorance of medical facts related to the Essure device. And so when the average patient goes in to see their doctor, they're not managed properly. Okay, that's the bottom line. And these ladies continue to suffer month after month, year after year with the Essure complications, problems with the Essure. And they're dismissed. They are continuously dismissed. And this delay in management is known as failure to diagnose, failure to treat. Two legal terms that I think all of my colleagues that are handling patients with Essure devices should be fully aware of. So first of all, if you're putting the Essure device in, every single time before you put a device in, you better go ahead and check the FDA website. You better check the current announcements, even the social media, because it looks like social media is months or even years ahead of what is actually posted in the medical literature related to Essure. And this is a key point. Don't dismiss social media. You have to understand that you have to look at it with a grain of salt sometimes, because it's not always correct. But rest assured, I can tell you with a great deal of confidence that whatever has been posted in the Essure Problems Forum for the United States is factual to almost 100% correct. So all of those doctors that keep saying or dismissing their patients and saying, stop reading Facebook, stop reading social media, they don't know how accurate the information provided in the Essure Problems Forum in the United States is. It is extremely accurate. That was the information that was provided to the FDA, and the FDA agreed with us. They agreed that that information was correct, and that is the main reason why the FDA ordered Bayer to do the post-market trials, because we are seeing what's going on every single day, and yet Bayer has done no studies related to this these problems, because it's a vast number of symptoms, a vast number of syndromes that are associated with these Essure complications. So What is the take-home message? First of all, again, I am dumbfounded by the information that I'm receiving. I receive literally daily dozens of messages, and I have reviewed with confidentiality. I have reviewed hundreds of cases related to Essure complications, and the majority of issues related to that, yes, are associated with a defective product, but they go hand in hand. That it's not just a defective product or a defective insertion; it is also uh, defective management on the part of the doctor. We still have doctors, not only in the United States, but internationally, that are insisting that it is okay to try to remove these devices from a vaginal approach or hysteroscopic approach. Wrong. Don't even try it. Stop trying it. You are practicing, in my opinion, malpractice. Okay. Um, we have doctors with little or no experience that are trying to remove these devices laparoscopically, and they're leaving pieces behind. If they're only taking the tubes, they're leaving pieces behind and that are left in the uterus. And they don't even bother to try to check by fluoroscopy during the procedure or X-ray or CT scan after the procedure to see if any fragments were left behind. Wrong. Bottom line, failure to diagnose, failure to properly treat, malpractice. Okay, so here we go with the big bad word, malpractice. We see that. I'm seeing it. I knew that it was going to happen. You find out that there's a problem with something, with a device, that it has complications. Okay, the doctors are not trained on how to treat these complications. It's by trial and error. It's by, let me talk to this guy who doesn't do it either, and let's keep doing it, trial and error, and they keep hurting patient after patient after patient. And so you see that as doctors realize that there's a problem with the Essure device, we see an exponential increase in the number of uh, mishandled or improperly handled cases where patients end up just as bad or even worse following the doctor that to try to remove the device or following the doctor's hysterectomy. Okay, so here we are where the patient is suffering from an insertion and suffering from the removal. And why? It's because we as doctors were not trained by Bayer on how to remove them, how to manage them, and we are educating ourselves, self training with patients as the guinea pigs, and we're making mistakes every single day. And so, as we see lawsuits go in the direction towards Bayer, we are also going to see an exponential increase in number of lawsuits against doctors because we just don't know what we're doing. Okay, that's the bottom line. As the board certified OBGYNs, in the vast majority of cases, have no idea of how to manage Essure problems, the complications, and the proper surgical management of Essure problems, and for the removal of either the tubes by salpingectomy, coronal resection, or hysterectomy. They're all making mistakes every single day. So as the tens or dozens of surgeries that are done every day, I'm calculating that anywhere between 10 and 20% of those surgeries are associated with a complication that is due to malpractice. That is how high it is. So what are we going to do about this? I'm warning my colleagues yet again, as we have been right for the past 4 years. Do not put in an Essure device without knowing the black box warning, without disseminating that information, without using the proper informed consent. I'm going over informed consents that are for traditional tubal ligation. They don't cut the mustard. They're not going to work. You're going to get sued over those. You have to come up with an Essure black box warning, informed consent that is appropriate, that is and has enough information so the patient has made an informed consent. Stop using the standardized tubal ligation forms. If you don't have any experience on having removed the devices, don't start doing it now. Refer to a doctor that does have experience. Stop trying to remove the devices by salpingectomy if you don't have any experience, because you're going to leave fragments behind and you're going to get sued over it. Okay. Stop ignoring the fact that these patients have problems. If you think that chronic migraine headache has no association with the Essure device, you're wrong. It has been shown. We have seen plenty of patients that have had chronic migraine headaches that have that resolve after the Essure device is removed. So stop dismissing that. Stop dismissing rashes that it has no association with the Essure. Stop dismissing lower back pain, no association with the Essure. All of these problems are either associated with an autoimmune reaction, local or chronic autoimmune reaction to the device. I'm sorry, the majority, a significant number, I don't want to say all, a significant number are associated with autoimmune responses as well as GYN issues. Stop dismissing the patients. If you can't prove, bottom line, if you can't prove that the Essure device is not doing it, stop telling the patients that it's not the Essure device, okay? Because Bayer can't confirm that. No studies have confirmed that. So stop telling your patients that it's all in their head. Stop telling your patients that it's not Essure associated. Because what we're seeing for the doctors that are removing these devices, that up to 80 or even 90% of cases, the symptoms resolve, be it migraine, headaches, brain fog, depression, rashes, elevated weight gain, lower back pain, intestinal problems, irritable bowel syndrome. All of those symptoms seem to go away in 80% of cases if you remove the Essure devices. That's what we're seeing, okay? So stop dismissing Essure like it's not the cause, or think outside of the box. That's the point. If you don't do that, my colleagues that are treating patients and dismissing patients are going to get sued for malpractice. If you're not doing your research and your due diligence and looking at the potential issues on a daily basis before you put in a device or before you manage a patient with a device, you're going to end up getting sued for failure to diagnose, failure to treat, proper management, and of course the malpractice issues and your inability to properly remove the devices. And of course, post-operatively, inability to follow up with the patient properly. So these are my take-home messages. I'm sorry, ladies and gentlemen, that as we learn more about what's happening with the Essure complications, we are also seeing an exponential increase in the number of complications related to their removal because my colleagues are just not educating themselves. So you're going to have to educate your doctors. And if that means showing them what's going on Essure Problems forums, showing them what's going on in the social media forums, showing them what's going on internationally, you're going to have to do that because you're not going to be able to get the support from your doctor because a lot of times we think that obviously we're smarter than our patients. And a lot of times we're not. And we need to be educated because we haven't taken the time to really research what's been going on. And again, my thanks to the Essure Problems Forum because they're the ones that were the catalyst for everything and the ones that are the driving force behind the actual correct information that has been disseminated not only on a national basis, but an international basis. I hope this helps out. Again, ladies, do your due diligence. Please find yourself doctors that know what they're doing. Please make sure that you're not being dismissed. If you're having problems, find a doctor that understands what's going on with the Essure device, and hopefully this will help you. And for my colleagues that are out there dismissing all of this, be careful because a lawsuit is just waiting to happen. Thank you.